All right. So my name is Bryce Kybers. I'm the project manager for Taking Texas Tobacco Free, and I work in Austin at the local mental health authority called Integral Care, and we provide behavioral health and intellectual and developmental disability services to the people in Travis County. Integral Care, we partner with the University of Texas through a subcontract to round out our team for Taking Texas Tobacco Free. And our project, we received funding from the Cancer Prevention and Research Institute of Texas. So CPRIT funds our program and our projects to bring these grants and to collaborate with the organization that we work with. And I'll let my supervisor, Teresa, would you like to introduce yourself?
Sure. Hi. Just one super quick correction on Bryce meant to say the University of Houston.
What did I say?
You said UT, University of Texas.
I'm so sorry. I apologize for that mistake.
Anyway, just that quick clarification. But my name is Teresa Williams, and I work with Integral Care as well. I've been here about 10 years. I've been working with local mental health authorities for close to 20. So very passionate about the work. Been working with Bryce since we started the Taking Texas Tobacco Free work, along with Dr. Reitzel and the University of Houston team. So I'm happy to be here. I'm happy to see so many folks joining us, and looking forward to this presentation.
All right. Dr. Isabel Martinez-Leal, would you like to introduce yourself?
Hi, I'm Isabel Martinez-Leal. I'm a research associate at the University of Houston, and I've been on this project for many years, along with Bryce and Teresa. And I help out with the trainings, and I also am the qualitative research specialist, so I conduct focus groups and interviews with staff and clients that are participating in our projects. And glad to see everybody here. Thanks.
Wonderful. Thank you, Dr. Leal. And Dr. Maggie Britton.
Hi, everyone. So I am also at the University of Houston, and I am a postdoctoral fellow, but my role within Taking Texas Tobacco Free is really the project manager on the University of Houston side. So I work very closely with Bryce on working with the centers. So looking forward to the presentation.
Very good. Maggie is relatively new to our project, and we're very happy to have her on board. So what we're going to do today, we're going to talk for the first part, probably for the next 20 minutes, we'll share some information about our project, what we're doing, the groups that we're going to be working with, why we've received this funding, and why it's important to address tobacco use amongst the population that we've addressed. And excuse me, so from our mission here, you can see that really what we strive to do is promote wellness amongst Texans by partnering with various healthcare organizations to build capacity for system-wide sustainable initiatives that will reduce tobacco use, secondhand exposure amongst employees, consumers, and visitors. And ultimately, we want to drive down the cancer rates within Texas. And I think from this mission statement, really the most critical thing is the system-wide sustainable actions that we ask centers to take to implement at their organizations. It's not a one-piece type of a project. It's a comprehensive, multi-pronged approach to addressing tobacco use. We know that if we just provide people with a referral to quit line, that's one effective way. But there's a lot of other things that we can stack on top of simply making a referral that's going to make that referral much more effective and give people even a greater chance of being successful. And then the sustainable aspect of it, as with many grants, we know that the money comes in, the assistance is there, and then once the grant money dries up, how are we going to move forward? And so we really work with the centers to develop some of these sustainable practices so that they're built in through policies or procedures, and also built in through ongoing training for staff. So those are really kind of the two unique things that we really work with centers on. And like I said earlier, and I'll get this correct this time, is that we are an academic and community collaboration between the University of Houston and Integral Care, and that we do receive our funding from the Cancer Prevention and Research Institute of Texas. So we've received funding through CPRIT since 2013. And in our first couple grants, we work specifically with local mental health authorities across Texas. And as you can see in this graphic, all the different local mental health authorities in the various regions of the state, many of these areas, or many of these centers that we work with are in areas that you're also serving. So each of these 22 local mental health authorities became 100% tobacco-free and provided tobacco treatment services to the people that they were serving. So we had a tremendous reach with these first two grants. And that was really that work really set the foundation for our subsequent grants and our continuing work today. Our third grant began in 2018 and just finished up a couple months ago. We work with 19 substance use treatment centers across Texas and 10 community organizations. And the substance use treatment centers became 100% tobacco-free and also began providing tobacco dependence treatment services to the people that they serve. Some of the community organizations that we work with, they didn't necessarily become tobacco-free, but they enhanced some of their tobacco treatment services and some community outreach and education through our trainings and the services that we provided to them. Some really innovative activities came out of working with some of the treatment centers in that grant. One thing that we talk about as far as tobacco control and what works and evidence-based practices are these four kind of tobacco control vaccines. And I stole this slide from a SAMHSA slide. And we know that these four activities work pretty well to address tobacco use and to drive down the tobacco use rates as a general population. Increasing access to cessation services, if that's referrals to a quit line, if that's providing services directly to someone, access to groups, whatever that might be, just helping people make quit attempts. Smoke-free policies, we know that smoke-free policies reduce the smoking rates, that people, if they don't quit completely smoking, that they smoke less or they use fewer tobacco products in smoke-free areas. And on top of that, we have the health benefits of clearing the air of the toxic secondhand smoke exposure, which in and of itself is a very positive public health win. The next two tobacco price increases, that the more expensive tobacco products are, the less likely, especially for young people, that they're going to start smoking, and more people make quit attempts based on the price of tobacco products. And then some hard-hitting media campaigns, which the Truth Campaign is one of those campaigns that are really addressing some of the disparities in how the tobacco industry targets specific populations with their messaging and their products. So within our project, we really focus on those first two, increasing the access to cessation services and developing those smoke-free policies. We do have some media campaigns through some print materials, but our print materials really are driving people to considering making a quit attempt or asking for help if they do want to make a quit attempt. So we have our own little kind of tobacco control vaccine within Taking Texas Tobacco Free. And this is kind of what our vaccine looks like through these four different program components. One, developing a 100% tobacco-free campus policy, providing basic education to employees, tobacco treatment education to employees. I'm sorry. providing evidence-based tobacco use cessation training and services, and then engaging the community as a whole, if that's through partnering with other organizations in your community or in your county, that's attending health fairs, providing training and technical assistance to other organizations based on your expertise and the resources that you've received from us. That's what we really look for in that component. And all of these components were developed to address some various barriers. We know that there's very, very high rates of tobacco use amongst consumers. For some of the substance use treatment centers that are on this call, anywhere from probably 70 to 85% of the people that you serve are smoking cigarettes, so very high smoking rates. But one thing we also know is that about 70% of the people that are smoking, they want to quit. They've made a quit attempt in the past year. So we're really providing a service that people want when we're helping them quit smoking. We also know that we have a high rate of tobacco use amongst employees. In Texas, the smoking rate is about 14.5%. But at some of the centers and organizations we've worked at, we've seen smoking rates up to about 35% amongst employees. So we also have to address the smoking tobacco use amongst employees as well through some of our programs and initiatives. And this is across the board at pretty much every center that we work at, that there's a very low knowledge base about how to treat tobacco use. And so we have to bring that knowledge up. We have to educate our clinicians, our professionals on how to help people break that addiction to tobacco and nicotine. And then also what are effective and evidence-based tobacco treatments. And a lot of times we're not even asking people if they use tobacco products. We just ignore it and we glance over it, or maybe it's built into our EHR systems and we just ask that question because it's a checkbox, and we move on and we don't take it a step farther and ask them if they want to quit or provide any type of services or even a referral to help them if they do want to quit. And then which goes along that they don't receive assistance or advice to quit. And then high tobacco use rates in some of our communities. We know that tobacco use is much higher in rural communities and more urban communities. And even in different parts of the state, we see significantly higher spit tobacco rates. And so a lot of differences in a very, very large state like Texas. So I won't go through each of these objectives, but all of our objectives are designed to address those barriers that centers experience when trying to develop a comprehensive tobacco program. So here's some of the disparities that we see. Like I said a little bit earlier, the smoking rate, and I misquoted it. I said 14.5%, it's 14.7%. And the good news is we're a little bit lower than the national average. We're about 1%, a little bit over 1 percentage point lower as far as smoking rate than the national average, which is 15.9%. But the kind of on the downside of that, we have about 28,000 Texans dying each and every year related to smoking alone. And that's a very, very big toll on our state, having that many people dying each and every year. Now we're going through a global pandemic where we've had about 60,000 people die from COVID-19 in Texas over the past year and a half. So we have, kind of a comparable pandemic taking place each and every year through the number of people that are dying from tobacco use. As you can see, a lot of smoking rates are driven by education, which the first two bullets show there, with less than a high school degree, very high smoking rates, almost 25%. People with a high school degree, almost 21% of those folks are smoking cigarettes, and then very much income driven as well for people making less than $50,000 a year. We have about 38% of folks smoking cigarettes. Rural areas, like I said, as you can see there, almost 20% of people living in rural areas are smoking cigarettes. African American people are more likely to smoke cigarettes at 18.7%, and people with no insurance smoke significantly higher. So they might be on Medicaid or Medicare, then they're smoking at 22% rate as well. So all of these populations are more than likely being addressed or being served by your organization. We know that people with behavioral health diagnosis, about 35% of those individuals are smoking cigarettes. Here at Integral Care, we're very, very aware of that with the population that we're serving. And then, like I mentioned earlier, people with the substance use disorder are smoking at very high rates. All right. So some of the misconceptions, and this is kind of goes along with that knowledge and that information that we try to share with the centers that we partner with, that people who are seeking treatment, that they don't want to quit smoking, right? We hear that time and time again from clinicians and professionals saying, well, it's a waste of our time to ask people because they don't want to quit. And that's not necessarily true. Anywhere from 50 to 70% of people want to quit or have tried to quit in the past year. And many people have tried to quit multiple times during over their lifetime of smoking cigarettes. There's a very pervasive belief that quitting smoking is going to jeopardize a person's recovery or their treatment outcomes, and it's going to make them relapse. Especially in substance use treatment, that it's too much for them to do. They got to take one thing at a time, which we know that's not true. There are many studies that are showing that quitting smoking at the same time that someone's getting clean or sober, or in treatment or recovery for their mental health symptoms, that quitting smoking actually increases outcomes and decreases stress, anxiety, and depression. And that it actually helps people significantly, not only physically, but in their recovery and emotionally and psychologically, we see significant increases. For substance use treatment centers, this was a concern with almost all the centers that we worked with. They were afraid that people were going to stop coming to treatment if they couldn't smoke, that they were going to go to a different treatment center. And that was one we really didn't have an answer for because we hadn't worked with these smaller substance use treatment centers before. Research had showed that that wouldn't happen, but we couldn't give people a definitive answer. And over the past 2.5 years in those 19 centers we worked with, no center we've ever worked with has had a decrease in census. So it really, folks are not choosing to different treatment centers. They're still coming in for treatment and receive the care that they want, whether or not they can or they can't smoke cigarettes. So we're very happy to report that, and we're pretty confident that if you become tobacco free, it's not going to impact your bottom line. What might happen is that folks who are smokers are going to choose to go somewhere else where they can smoke, but people who do want to quit smoking, which, like I said in the very top bullet, that 50 to 70% of people who have tried to quit smoking, and you're offering that specific service to them, that makes your center very attractive to them, and that they are more than likely going to want to come to your treatment center because they know they're going to get help quitting smoking along with their other addictions as well. And then people with behavioral health conditions that they can't quit smoking, they're incapable of quitting. We've heard this many times from clinicians over the years as well, and that's certainly not true. We know that anybody and everybody is capable of quitting. What we've found is a lot of times people quit cold turkey, they try some other things, and they might try a medication like nicotine patches, gum, or lozenges. They don't use a strong enough dose, or they don't use them long enough. So they're on the right track. They just need a little bit of assistance to get them over that hump to help them. And so that's where we come in as clinicians to provide them a little education and a little bit of assistance. So what are we doing with this grant we're going to be recruiting 18 rural substance use treatment centers and 10 rural health centers to participate in approximately over the next 18 months. Our grant is for a little bit over 2 years, and there's a implementation process for that, and then we're going to spend about the last 6 months of our grant, or so 6 or 9 months, evaluating a lot of the results from our project. So we really have an enrollment period of about 18 months to get all the centers on board. And what we're really looking at doing is breaking this into 2 different cohorts, kind of an early adopting cohort and a little later adopting cohort based on their readiness and interest in wanting to participate. So what we're looking for in our first cohort is recruit between 8 to 10, 8 to 10 substance use treatment centers, and anywhere from 5 to 6, maybe 7 rural health centers to start relatively quickly, and with a start date maybe the first week of October. And then the second group, we would probably have the start date for that second cohort around mid-2022, so maybe around May, June, somewhere around there in 2022. So as you're kind of thinking about this, what group you might want to be a part of, if you're really excited about moving forward with this right now, we would love to have you as that first cohort. But if there's some things going on that you want to work with and some other priorities within your organization, but you want to participate, you might be perfect for that second cohort. So what the implementation process looks like, it's about a 6 to 7, maybe a 9-month process from signing a memorandum of understanding, going through the trainings, identifying a tobacco-free date, and then moving through that process. So it's not an immediate change that takes place. There's a really structured process to do this and to do this correctly and to have some really, really positive outcomes at your center. We do collect some data, surveys, and then data collection on nicotine replacement therapy that's dispensed, quit rates amongst folks, ongoing trainings that you provide to staff. So we start that during the implementation period, and then it continues for about 12 months after your post-implementation period. So if you have a quit date set for January 1 of 2022, we would ask that you continue to provide us data until January 1 of 2023. So what can we offer to your organization? And well, I typed in here 2-hour training. I should have changed that first bullet completely. I overlooked that. But that's from an old slide. What we do is we provide a 1.5-hour or a 90-minute training for all of your staff. We used to break it up into clinical staff and non-clinical staff and give them kind of 2 different presentations. We combined it and we put it all into a 90-minute presentation where we want every single one of your staff members to have a good, solid baseline understanding of what nicotine addiction is and how folks can get help to break that addiction to nicotine. So it's a really good training. We've had a lot of people, both smokers and non-smokers, not very happy that they have to go to a training like that. But after the training, they say that it was very informative and very useful and meaningful training. So we have some really good outcomes as far as increase in knowledge from those trainings as well. We send a staff member to a certified tobacco treatment specialist training at MD Anderson. It's a virtual training that they have, so we'll pay for the registration for that as long as it's a virtual training. There is no lodging expenses, and the reason why we have a person from your organization become a certified tobacco treatment specialist is so now you'll have your own tobacco expert at your center for program development, quality improvement, quality assurance, staff training, ongoing staff training, and things like that, so that when the grant does end, you still have that expertise and the ability to carry on your program. We're also incorporating a train-the-trainer program to develop a long-term sustainable training program. And this would be, depending on the size of your staff, maybe 2 or 3 different employees that they can do new employee orientation, do ongoing annual refresher trainings with staff, things like that. And if a trainer quits, they can train a new staff member to become a trainer. And so that's, once again, building in that sustainability. We will provide regional MI trainings, motivation and interviewing trainings during the summer months. We have 2 faculty members from the University of Houston that are MI certified trainers. And so those regional trainings will have centers come to us. It's a 1-day training, 8 hours. Folks can get CEUs and for attending that training. And then we also provide information about MD Anderson. They have a program that's called Project Teach, which is a weekly video conference, tobacco dependence training and education session. It's free for anybody and everybody to attend. So any of your staff members could attend that for ongoing education and training. And then there's a number of webinars and local and regional trainings that are made available from time to time, and we always communicate those to centers as we hear about them and if they're in your specific region. The other thing that we do through our program is we provide centers with nicotine replacement therapy. So nicotine patches, nicotine lozenges, and nicotine gum. These are all over-the-counter medications. You don't need a prescription as long as folks are over the age of 18 to get these. So we provide centers with anywhere from $2,000 to $3,000, what we call a starter kit, to provide nicotine replacement therapy for free to your clients and to your employees to help them quit using tobacco products. The photos here, we use products from GlaxoSmithKline. We don't receive any money from them. They have a nonprofit program, so we're able to purchase some of these products at a significantly discounted price. But we use the Nicoderm CQ patches and the Nicorette gum and lozenges. I know that some of the rural health centers, you may have some programs through your pharmacy where you could purchase other nicotine replacement products for a little bit cheaper or at a very similar cost. And that would be something that we would have conversations with you about as you move forward to sustain your program to continue to provide these products long-term to the people that you serve. We also provide a number of posters and signage. So as your facility becomes tobacco-free, this is an example of the sign from Billy T. Catan Outreach Center, which is a small outpatient substance use treatment center in Victoria, Texas. So this was a sign that we made for them. And we make exterior signs, metal signs that you could put around your campus. And we have a graphic designer that creates these signs, and then we pay for the development of them, and we mail them up to you. We also have a number of posters, which I'll pull up our website in just a little bit and show you the various posters that you can pick out, and we'll mail them up to you. Also, the technical assistance, that's where Maggie, myself, and some other staff members, we come into play with the policy development, the program implementation, the enforcement of policies, and the sustainability. So every step of the way, you have my support and the support of our entire team. Like I said, our website, which is Taking Texas Tobacco Free, we have a couple implementation guides on there that have step-by-step instructions and suggestions on how to become tobacco free. We also have a trainer guide for our Train the Trainer program and a couple videos and a continuing education model as well. So the next steps. So if your center is really interested and want to jump on board, this is what you want to do. Reach out to myself or Maggie, and our contact information is on the last slide. And what we'll do is we'll set up an initial meeting. We'll talk about what this project looks like, and what it might mean for you. And then we'll walk through some of these steps. One of the first actions would be to have your CEO sign a memorandum of understanding, which was attached to the meeting invite today, and get that to us by the end of the first week of October. So in about 2 or 3 weeks, once we get that memorandum of understanding, then you're officially on board, and we really can start moving forward and start working on a timeline, crafting a timeline. One of the key things that we ask organizations to do is to identify what we call a center champion. And that center champion is a direct liaison that's going to be implementing a lot of these initiatives and tasks, and also working directly with us to coordinate trainings, to get folks on board. And then creating and then we have some surveys. We have a pre-implementation and a needs readiness survey. And then Dr. Liao, she does the pre-implementation focus groups. So those are kind of the first 2 or 3 beginning activities that we have to move forward with. And then, like I talked about earlier, the CTTF virtual training. So your center champion is really up to speed on a lot of different tobacco control and tobacco treatment initiatives as we move through these projects. On kind of a side note of our project, this doesn't necessarily relate to this grant specifically, but we do have a data collection survey, and we've many of you, especially some of the substance use treatment centers, have completed this survey already, and that's how we know that you're interested in our project. But essentially what this survey is looking at is we're going to be providing your input will provide a roadmap on how the state can improve tobacco treatment services in the coming years. This is part of a 5-year CDC grant that the state of Texas received through the Department of State Health Services, and ask questions about what your organization is doing to provide tobacco evidence-based tobacco services, your thoughts and the use of the Texas Quit Line, and barriers and facilitators to expand tobacco control efforts at your center. It should take about 20 minutes to complete it. And once you do complete it, we'll provide you with a $20 Amazon e-gift card if you're able to accept a gift like that. And we ask that you complete at least 75% of the survey to be eligible to get that card. And we'd ask that only one person from each physical location of your organization complete that survey, so we don't have multiple people from the same clinic completing that survey. And so we have 2 different surveys. We have one for the standalone substance use treatment centers, and so you could click on that link. And then for FQHCs or rural health centers, if you're not providing direct chemical dependency counseling, but maybe you're referring people to a program, and I'm very sure you're probably seeing people that have substance use disorders. There's some kind of similar questions, but phrased a little bit different for you to complete as well. So we'd appreciate you completing those surveys for us. So with that, I am going to just open it up for questions that people. So here's on the very last slide, before I open it to questions, our contact information, my cell phone number, my email, and then Maggie's email address as well. And then our website. We also have a link on our website where you can email us directly from our website too. And we'll be in touch with you. Our social media, we're on Facebook and Twitter, so you can find us on Facebook and Twitter as well. So with that, what would be some questions that people have about our project?
Hi, good morning. My name is Mayra Mendoza from Project Vida. I just want to know if you are going to provide a curriculum to the community, any curriculum that you are managing or something like that.
We do provide a curriculum. When I say provide, we have a curriculum. We have a couple different curriculums on our website. The one that we particularly like it was developed by psychiatrist, Dr. Jill Williams out of Rutgers University, and it's geared specifically toward people who have a mental health diagnosis. The reason why we like that is it's very simple language, very easy to facilitate. There's some really engaging activities in it. So that's one resource that we have, and you can find that on our website, and I can pull that up and just show it to you. It's under our toolkit. If you click on that one link on the PowerPoint, takingtexttobacco.com/toolkit, scroll down just a little bit. There's going to be some group resources in there as well. But then we have some suggestions. Dr. Martinez Leal came up with some group suggestions and individual activities to do with clients that are also on our website. We have some quit kits, or not quit kits, but quit plans, very short, simple quit plans available on our website. The one thing that we haven't, it's the curriculum developed by Rutgers University. It's long. It's actually a facilitator's guide, and we haven't translated that into Spanish. It's only available in English. It's 168 pages long, but you can just go down and print out or use specific activities. But we haven't translated that one into Spanish. So that's kind of one of the bad things about that program, or about that curriculum. It's only available in English.
Thank you.
Mm-hmm. So some other questions. Anyone else have some questions about our project and getting started with us?
We, as a Project Vida, we are very, very committed to have these resources, these practices in our an organization. However, I think that it's very short time. We are managing a lot of grants right now, funding, managing a lot of things related to COVID-19. Mm-hmm. So I am very, very interested. We have already a curriculum with freedom from smoking. We are conducted this curriculum from years, and recently we established a system, referral system with the providers and in the quit line. So we are starting to building this capacity, but I don't know if right now we are ready to start because it's very, very short time in October, the first cohort. So, but believe me, I'm very interested in maybe if we can do this in this time, maybe next year, because right now we have a funding with HERSA and hypertension control, and part of our criteria with hypertension control is reduced tobacco use. So it's very related and very relevant to our programs, but maybe we need to wait a little bit in order to, start with this, but I'm very interested.
Very good. Well, very good. Like I said, maybe it's as part of that second cohort, and the real work of the grant, and it may sound kind of overwhelming when I go through some of those activities, but by identifying that clinic champion, there's really not a lot of work related to the implementation of the grant until a little bit, probably about 3 or 4 months down into the grant. That's when the real work kind of takes place. There's a lot of behind the scenes things that take place. But I think once we start training staff, which typically will take place about 3 or 4 months, about months 3 to 5, that's when it kind of, you start noticing some of those changes within the organization, and that it really does need to become a priority, kind of an organizational priority at that point. And Teresa, were you going to say something?
Yeah, I was just going to add that, especially right now with COVID going on and the importance of tobacco cessation, it's just completely intertwined and related. We can post in the chat a flyer that we developed just to highlight the connection between the two. And I can say specifically for interval care that we've prioritized the tobacco cessation with those groups that are the highest risk of COVID because of the risk of developing moderate to severe complications. So sometimes one of the best things you can do to improve people's COVID risk and hypertension and everything else is to help them quit smoking. So it should be, the way that I've tried to look at it is, it's just an added thing to everything that you're already doing. It's a 2-minute conversation added to your providers, and following up and providing resources. And the effects and the benefit to the patients is huge. So I just wanted to add that.
Yeah, and in fact, last year, kind of at the very beginning, or about midway through COVID, we implemented some tobacco treatment services at some of our protective lodges here in Austin, where we had people who had been displaced from some of the housing and some of the homeless shelters, because the homeless shelters closed down, and they were staying at hotels temporarily. And we took advantage of that opportunity. We provided tobacco treatment services to the folks that were staying at those facilities, and helped a number of them quit smoking. And so it's, with that emphasis of, it's going to help reduce your risk of contracting COVID, but then also, if you do get COVID, reducing the risk of having serious complications from it. So it's a balancing act, and we completely understand that. And thank you for expressing those concerns. Cheryl or Connie or Pat, Linda, anyone else? Have any questions? I haven't been able to look at the chat recently, see if there were some questions in chat. So if you want to look at some of the examples of our posters, Dr. Martinez-Leal, she shared a link to our website on there, and then Teresa shared a link for our smoking or vaping in COVID document as well in the chat, so you could open those up. Just real quickly, we have a minute here, so wrong one. I'm going to stop presenting. I wanted to just share our website with folks and go through that real quick, just to show you some of the different tabs. And so under our tools tab here, the implementation resources, and this is where we have the quit plans that you're discussing. The group resources here was the About Healthy Living a curriculum, and it doesn't just talk about quitting smoking. It talks about eating healthier, getting exercise, a lot of different health modification behaviors also. So a wonderful curriculum, some guidelines, and there's some group counseling resources, and the additional group activities are listed there, with some links for some mindfulness activities. We have signage examples. We have tobacco use examples here, the quit plans that I spoke about in English and in Spanish, and then our different implementation guides that we have. And within each implementation guide, we have some timelines, but this is a timeline, which I don't know if it's going to share or not. Well, I'm going to just skip that. But we also have our Train the Trainer program, which we have a kind of a walkthrough guide for that. You could click on any of these tabs to learn a little bit more about our Train the Trainer. And then we have a video that shows our 90-minute training that we provide to staff. And so we provide a very similar training to your staff as what's located on our YouTube page and on our website. Also under tools, our download center, which these are all print materials that we can provide to you. Poster on secondhand smoke exposure, poster on pregnancy. We have a lot of pregnancy and postpartum materials that we kind of partnered with the University of North Carolina to develop some of those. Posters specific for substance use treatment, sexual minorities, displaced individuals, electronic cigarettes. We have a number of different rack cards. These are little front and back side cards, talk about the impact of smoking has on people using substances, mental health, pregnancy, just smaller, like the posters that we had. So some really good information, and all these would be made available to you for free as well through our project. So please take a little bit of time to explore our website and learn a little bit more about us that way. So if there's any other questions that anyone might have about our project. All right.